Let me ask you something. Have you ever been sitting quietly, maybe scrolling on your phone, lying in bed, or standing in line, and suddenly it feels like your heart skips a beat? Not pain, not exactly racing, just a strange thump, pause, then a stronger beat, and for a split second your mind jumps to the worst possible conclusion. Is something wrong with my heart? If that's ever happened to you, you're not alone. And today I want to explain what's really going on, calmly, visually, and without fear. Because most of the time, this sensation has a surprisingly simple explanation. Before we dive in, if you appreciate clear, reassuring health explanations like this, take a moment to like the video, subscribe, and tell me in the comments, where are you watching from? Alright, let's slow this down together. Here's the first thing most people get wrong. When your heart feels like it skips a beat, it usually didn't stop. In fact, in many cases, your heart actually beat too early, not too late. That sensation you feel, the pause followed by a strong thump, is often something called a premature beat, and while the name sounds alarming, it's incredibly common. Most healthy hearts do this occasionally. The problem isn't the beat itself, it's the interpretation. Your brain notices the unusual rhythm and fills in the blanks with fear. So let's replace fear with understanding. What's actually happening? Think of your heart like a well-rehearsed orchestra. Every beat is guided by electrical signals that travel through precise pathways, telling the heart muscle when to squeeze and when to relax. Sometimes, an electrical signal fires a little early. That early beat doesn't pump much blood, so you barely feel it. Then the heart pauses for a fraction of a second to reset. The next beat comes with more force, and that is the thump you notice. Biologically, this is your heart correcting its rhythm. Emotionally, it feels startling. Practically, it often means nothing dangerous at all. Now let's talk about why this happens. Common habits and triggers. Mistake number 4, caffeine and stimulants. Let's start with an everyday one. Coffee, energy drinks, pre-workout, even strong tea. Caffeine stimulates the nervous system. Inside the body, it increases adrenaline and makes heart cells more electrically excitable. Biologically, this makes premature beats more likely. Emotionally, it can increase anxiety, making you notice sensations more intensely. Day to day, this shows up as palpitations after coffee, especially on an empty stomach or during stress. Mini cliffhanger, and caffeine isn't the only silent stimulant. Mistake number 3, stress and emotional tension. Stress doesn't just live in the mind, it lives in the body. When you're stressed, your nervous system shifts into alert mode. Stress hormones like adrenaline circulate, making the heart more reactive. Biologically, this can trigger skipped or extra beats. Emotionally, the uncertainty feeds worry and hyper-awareness. Practically, people notice palpitations during quiet moments, right before sleep or during stillness, when the mind finally slows down enough to notice the body. Your heart isn't failing, it's responding to tension. Mistake number 2, poor sleep and dehydration. This one surprises people. When you're sleep-deprived or dehydrated, electrolyte balance shifts. Electrolytes like potassium and magnesium help regulate heart rhythm. Biologically, low levels can irritate heart cells. Emotionally, fatigue lowers resilience, making sensations feel more threatening. Practically, skipped beats show up after late nights, travel, illness, or long workdays without enough water. Your heart depends on rest and hydration more than we realize. Now the most misunderstood one. Mistake number 1, health anxiety and body scanning. This is subtle, but powerful. When someone becomes very focused on their heartbeat, the brain amplifies normal sensations. Biologically, heightened nervous system sensitivity makes benign rhythms more noticeable. Emotionally, fear creates a feedback loop. Sensation leads to worry, which leads to more sensation. Practically, this shows up as constantly checking your pulse, Googling symptoms, or feeling palpitations more at rest than during activity. Ironically, the heart is often healthiest during movement. So what do you do with this information? First, context matters. If skipped beats are occasional, brief, and not accompanied by chest pain, fainting, or severe shortness of breath, they are usually benign. Second, support your heart's environment. Hydrate well, sleep consistently, moderate caffeine instead of stacking stimulants. Biologically, this stabilizes electrical signaling. Emotionally, it restores a sense of safety. Practically, episodes become less frequent and less noticeable. Third, regulate the nervous system. Slow breathing, gentle exercise, and stress reduction calm the heart-brain connection. Your heart listens closely to your nervous system. And finally, know when to check in. If palpitations are new, worsening, or paired with concerning symptoms, getting medical reassurance is not weakness, it's wisdom. Let me say this clearly. A skipped beat does not mean your heart is fragile. It does not mean something terrible is about to happen. And it does not mean you've lost control of your body. Most hearts are resilient, adaptive, and incredibly good at self-correction. Understanding what's happening replaces fear with familiarity. And familiarity brings calm. Your body is constantly communicating with you, not to scare you, but to be understood. When you learn the language, the fear softens. If this video helped you feel more at ease in your own body, like the video, subscribe, and share it with someone who's been worried about their heart. And remember this, small changes bring comfort, understanding brings freedom, and confidence grows when fear loses its mystery. Take care of your heart. It's been taking care of you all along. I'll see you in the next one.